working.
Not sure about.
Yes.
I think Kenyans need to rise and really, sometimes I ask myself, what would happen if we just decided not to pay? Of course, that's also another discussion for another day, because this country, we have been tested and tried in many, many sectors. I remember a time when those in the oil and gas industry said, we stop our vehicles on the roads because of high rates of fuel, and no one even dared. People just went in and bought the fuel, and you drive your car and you mind your own business.
Could that be the problem with Kenyans, that despite all these glaring problems that we can actually see and feel, that we have this capacity to accommodate a lot of pain without any reaction? Could that be the part of
our stoicism? That capacity you're talking about does not help, because remember that even as we become very strong and we assume that we are very turgent, the number of WhatsApp messages that you get invited into every single day, every morning. I have just been taken into 3 this morning as I was coming here, and I asked myself, so who are these?
Health related.
They are largely health related. People even no longer talk about education. They are largely health related. And it's because somebody says, I walked into the hospital and I thought my cover was going to save me. It did not save me. And the government must rise to the occasion to respond to some of these very difficult questions that Kenyans are asking. As at least for Kenya Kwanza, make one thing work, even if you cannot make any other thing work other than corruption and your self-interest, but try and make at least one thing to work. And if that one thing was to be made to work, I would recommend that we really focus on the health sector. And I was hoping that by having a doctor as a person in charge of the health ministry, then things would be very different. And because you have also of course, the PS level is different, but at least at the level of that policy, the visionary aspect, the mission of the ministry, let the people who sit at the apex of the ministry make health work. I know that there is a big struggle even with county governments, Fred, because health is fully devolved as per Schedule 4 functioning. So part of this confusion would be maybe the number of cartelic ventures that the people at the ministry at the national level want to get involved in, if at all there is any, so that this over excitement around usurping the powers of county governments to be able to want to be seen to be doing things at the national level, and therefore over concentrating in things which are not even.
Could that actually be the problem, that it is a devolved function, but they're not allowing counties to probably take a lead in this transition?
It could be part of the problem, because what the Constitution envisions in Schedule 4 is that the national government would really focus on policy issues for health, and then allow county governments to deal with these nitty-gritties. I don't think that if county governments were even to, procure a system for this issue about shift and all that, it would cost them the kind of figures that we are talking about, because what that has indicated is almost twice the amount that all 47 counties get. Because if you talk about over 900 billion for a system, and counties are only getting 4 billion and 1 million, then the challenge is, what is this that is happening? Could that be the reason why the national government, the Minister of Health, is unable to sit and think through and have a proper system that can make shift work? And so it's not to say that even if we were to devolve this to the counties, it would be perfect. But I am very sure that the levels of investment, the concentration in terms of county governments to make health work would be much more higher. Why? Because at that level, you meet your MCA. At that level, you meet your waziris there. It's not about Afya House, where you go and you get AP officers and the whole place is cordoned and is sealed off for the public. At the county level, you can easily access your governors and complain. And this organizing of Kenyans that we are saying that is being challenged then becomes quite easy. But in this case, county governments can say that is not our responsibility. And it is because every day they see the national government, particularly the president. Even during Mashujaa Day, we have tried to look at how many governors spoke about health in their statements or in their addresses. Almost none. Because in fact, most elected leaders did not even attend those functions. So the prioritization, the levels of investment and concentration in terms of what the Minister of Health needs to do and what we see happening on the ground, I think is so hard. It is very tough. It is so bad for the people, the families that are suffering, the people who are hospitalized, and largely even for those who have already lost their lives. And that really should be a rallying call for this government to ensure that at least one thing works. Make one thing work.
And yes, indeed, at least the Daily Nation has done us justice on the front page.